Yes?
Hi, I am your nurse today. My name is Gabby. I'm just gonna do my proper hand hygiene here. Could you tell me your name and birthday?
Darian, and my birthday is 11/18/1997.
Amazing, Darian. And we are just gonna do a head to toe assessment on you today. It should take us under 20 minutes. I saw that you had some ankle pain that you reported on your chart.
Just been a little sore recently.
On a scale of 1 to 10, what would you rate that pain? 0 being no pain at all and 10 being the worst pain you've ever been in?
Give it a solid 6.
A 6, okay. And is it on that right medial
Mm-hmm.
ankle?
Yes.
Amazing. When did that start?
About a week ago.
Okay, and
I think I might have just landed on it funny when I was running.
okay. And then does it come and go, or is it pretty consistent?
Not when I'm sitting, but when I'm walking, definitely the pain's there.
Okay, and have you, like, is it sharp, dull? What kind of pain?
Medium.
Medium. Sure. Sharp or dull?
Kind of sharp.
Okay, sharp pain. And have you noticed anything that makes it worse when you run?
Yeah,
That's
when I
what you
run.
said.
Yeah.
Anything that makes it better?
Right, when I elevate.
Sitting elevated. Okay, and then
Cold compress.
have you done anything to make the pain better? Any treatment? Tylenol?
Yeah. So
Yeah.
I took some Advil today.
Amazing. Okay, and you can lay back if you would like.
Yeah,
Just based off of general survey, what we have been assessing just as the patient walks in, we can see that her physical appearance and behavior are pretty positive. She looks very appropriate for her age. Her skin color looks nice and healthy throughout, not too pallor or anything. Her height and weight. Darian, could you say your height and weight?
My height is probably 5'6", and my weight is 130 on a good day.
On a good day. Okay, we love that. So her BMI is about 21.5-ish, which is very normal for her age. We also inspected her mobility and gait while she walked into the office, and it is very normal for her age, and she runs. She's very active, so that is great. Her body structure, very great. Her posture was positive, as we could see when she was sitting here. Darian, how would you say your nutrition is?
I eat pretty healthy.
Pretty healthy. Would you say you get like 3 to 5 servings of fruits and vegetables a day?
Yeah, about.
Amazing. We aren't noticing any physical deformities, as you can see. If you want to sit up a little bit more,
I'll sit up. Yeah, of course. You want to give me like a back?
All right, perfect. We are just going to assess your level of consciousness. Can you tell me who you are?
My name is Darian Dunn.
Okay, and can you tell me where you are?
I am at the hospital right now.
And can you tell me what day it is?
It is December 2nd, 2020.
Amazing. And can you tell me who was just elected president?
Joe Biden was.
Okay. Thank you so much. All right. First, we're going to inspect her skin and nails. So you can see her skin temperature is very normal and nice and warm, and it's moist, nice and moisturized. Good job, Darian.
Thank you. The cocoa butter helps.
Oh, the cocoa butter. Okay, and you can't see, we're not seeing any lesions, although she is covered up for the sake of this assignment. There's no lesions. Her fingernails are nice and normal, round. She does have nail polish on, but we're going to check her capillary refill. And nice and good, under 2 seconds, which is great. Can you do this for me? Put your fingernails together.
A little heart.
Like a little heart, yeah. And you can see that diamond, so she does not have any clubbing, which is great and normal. Moving on. Okay, we're going to inspect your head and face now, so you can see her scalp. Very normal hair texture. It's nice and smooth. Looks like she takes care of herself.
Thank you.
Hair distribution is thick-ish, and we have no bald spots or thinning. Have you noticed any thinning?
No.
Yourself? Okay, great. And then facial features, we notice that her eyes are symmetrical and her eyebrows are symmetrical. Would you mind looking straight at me? And can you smile? Okay, and we notice that both sides go up proportionally, which is what we are looking for. Okay, and now we are going to inspect Darian's eyes. So if you could just stare straight forward at the camera for me. We're going to look at that. And that. And then stare at that pen light for me. Thank you. So Darian's eyes are perla, which is pupils. Pupils are equal and round and reactive to light and accommodation. So hearing, have you experienced any hearing loss recently?
No, I have not.
We are going to assess for any, what do you call it in the ears?
Earwax?
Yeah. Darian, how are you cleaning your ears?
With a Q-tip?
Okay, amazing. And you're just doing the outer area?
Yes.
We don't want to go in too far as that could cause hearing loss.
Correct.
You can notice that she has some piercings, 3 on both her right and her left, but all appear to be healthy and not infected. They are symmetrical as well and in line with each other on both sides. Next, we are moving on to her nose. So her external structure is in line proportionally with her face, and we're going to assess for any drainage. Amazing, none.
Clear.
That we can see. Would you mind, we're going to test for patency with your nose, so cover one nostril and breathe in and out. Great. And then the other one, breathe in and out. Great. So her airway is patent, and we notice that as well because she is breathing through her nose prior to this. Okay, we are going to do the mouth and throat now, so if you could just open up and say ah.
Ah.
Perfect. Back there is pink and moist, and we're not noticing any lesions or lacerations. Her teeth are very nice and white. Looks like she takes care of her dental care. We are just gonna check out that uvula back there and do the tongue depressor. Okay, and yep, you can see that her uvula does rise and fall. I apologize. Her uvula does rise and fall, which means it is in good shape and healthy. We are going to see here that her trachea is nice and in line with the rest of her facial features, and it's in a normal, healthy spot. Before we move on, we are going to test the range of motion of your head and neck. So if you could tilt your head forward like that. Perfect. And then backward. And then ear to shoulder without moving your shoulder. Ear to shoulder. Great. Amazing range of motion, Darian. We are going to inspect and palpate your arms now. So once again, the temperature is very normal. We aren't seeing any rashes, lesions, or lacerations. The color throughout, very healthy. We're gonna do some range of motion checks here. So if you could just push against my hands. Great. And then you do like a bicep curl like this, other way around. Yes. Great. Okay, and then you're gonna do wrists like this, like that, like this, and then like that. And then wiggle your fingers. Perfect. Couldn't be better. And we are going to get your radial pulse really quick. You can just put your arms like that. Okay, and that is a 2+ bilaterally with normal rhythm. Next, we're going to move on to your respiratory system. So I'm just going to monitor your breathing. We're going to start on your front side. And have you noticed any kind of breathing problems recently?
No.
Okay, so the top sounds up here are going to be our bronchial sounds. So we're going to start up here. Okay, great. Breathe in and out. Amazing. And now we're going to move down to bronchovesicular. Breathe in and out. Breathe in and out. And we're going to move down to vesicular. So sorry. Breathe in and out. Okay, and then one more on the side is the other vesicular sound. Okay, and now we're gonna have Darian lean forward, and if you could just come this way, camera Kate. Just a sitting position would be appropriate. There we go. Could you kind of get the back here? Okay, so we're gonna just start at the back. You can breathe normally, Darian. We're gonna go down like so. Okay, and there are no adventitious sounds, so she is in good shape with her respiratory system. All right, next cardiovascular system. So we are going to check out your heart rate and different parts of your heart. So we're going to start with, did we get your carotid pulse yet? No, I don't think we did. So we're gonna
the receptor.
I'm going to get your carotid pulse really quick, which we can't do both sides at the same time. Could kill a girl.
Is that a funny joke?
No, it's not.
That was funny, Nurse Gabby.
Okay, that is a 2+ bilaterally with normal rhythm. All right, and now we're gonna auscultate the 5 points of the heart. So first, you find the angle of Louis, which is right here, and then you're gonna go to her right to find the second intercostal space, which is the aortic pulse point. So you're just gonna listen there. You can hear it pretty well. And then you're going to go to the second intercostal space on the left, and that is going to be your pulmonic valve. And then down the left to the third intercostal space, and that is going to be Erb's point. And then your fourth intercostal space is the tricuspid. And then her fifth down here, underneath, I'm sorry, is her mitral valve and her apical pulse, which is where you measure for a full minute. But for the sake of this, we're just going to do 30 seconds. Okay, and that pulse is 54. All right, and now we are going to move on to the gastrointestinal system. I can put this on my neck. So, do you have any GI problems?
No.
Also forgot to ask you if you have any allergies, and I know that you have a gluten allergy, correct?
Yeah.
And how does that affect you?
I just get occasional hives.
Some hives. Okay. Well, I am going to auscultate your GI area first before I palpate, and we're going to just inspect. Well, for the sake of this, we don't really need to inspect, but you want to make sure that the color is consistent with the rest of her body and that there's no distension. You can just lay down completely. Yeah.
Okay.
Make yourself at home. Okay, we're going to start with her left lower. And yep, you can hear some. Wow, you can. Yep.
I just ordered
There's some digestion happening.
Pretty hungry.
You want to make sure you're getting in all 4 of the quadrants to identify any problems that might be happening. Darian, when was your last bowel movement?
Oh, this morning.
This morning. Okay, and when was the last time you ate?
About 2 hours ago.
Okay, perfect. Well, that's why she doesn't have very loud bowel sounds. They're a bit diminished, but you can tell that things are happening in her intestines. So we're just going to palpate for pain. Do you feel any pain? Just a light palpation?
Nope, feels good.
Okay, and we are monitoring her facial expressions as well for any signs of discomfort, but she appears to be just fine. And you want to make sure you palpate in all 4 quadrants as well. Okay, we are going to inspect. You feel free to sit back up.
Okay, thanks.
Thank you. We're just going to inspect. Do you mind if I lift up these a little bit?
Mm-hmm.
Sorry, I don't want to cut off your circulation. We're going to inspect her lower extremities. You can tell there's hair on her legs, so there's vascularization. They're nice and warm, and yeah, they feel great.
She goes your day.
The color is pink and normal. Her legs are symmetrical, and we are going to inspect your joints. So if you could just sit at the edge of this bed for me, like so. Is that amazing? And you're gonna push against. Okay, yeah, I wasn't really ready for that. And then you're gonna, yep. And then can you lift your legs up kind of like straight? Yes, amazing. And then don't put it back down. Point your toes if you can and flex them. And then can you do inward circles, outward circles? Okay, wiggle toes if you can. And then can you feel my pinch there?
Mm-hmm.
Amazing. We are going to, I believe, do your pulse. Yep. Okay. You can lay back down. We're gonna just get that pedal pulse. You can feel it through your socks. Typically, you wouldn't do this through socks, but that is a 2+ bilaterally, and I believe we are done there. So I will send the doctor in and let him know that you are ready for him. Can I get you anything before I leave?
Water would be nice.
Okay, I can do that. Here's your call light. Call me if you need anything.
Okay, great.
And typically we would put both bed rails back up. However, we don't have any bed rails here. I'm gonna do hand hygiene on my way out, and then go grab the doctor.
Thank you, Nurse Gabby. You were
Thank
great.
you so much for your patience today,
Yeah.
Darian.
Yeah, you're great.
Hopefully we can figure out that ankle pain for you.
Thank